This is the Chapter 7 lecture. This chapter is titled Health and Behavior, another very, very important chapter for all of you interested in healthcare. When you read this chapter thoroughly, you'll come away knowing that unless we can change health behaviors in this country, we really can't have a significant impact on the rising cost of healthcare. So behavioral choices are key determinants in our health and well-being. When we look at the domain of behavior, there are multiple layers of that, multiple perspectives. Behavioral psychology is one, public health is another, social marketing another yet. And this chapter does a really nice job of delving into all of these different manners of looking at behavioral choices and changing behavioral choices. We are dying from chronic diseases or non-communicable diseases, and these are largely preventable. Therefore, knowing how to change behaviors around lifestyle will then lower the rates of these diseases, lower the impact they have on individuals, and of course, lower healthcare costs. Cancer, heart, and lung disease are the leading causes of illness and death. And as mentioned, many deaths are attributed to personal behavior. When you can modify your behaviors, this improves your health and your quality of life, which is so very important, and reduces healthcare costs. Most Americans are not healthy. Most Americans have at least one risk factor, and when we look at healthcare inequities and health inequities, we'll see there's a greater risk for these chronic or non-communicable diseases in low-income and minority groups. So let's look at a few of these. This is just a quick glance. Your textbook does an amazing job at kind of showing you the details and numbers, the statistics. Tobacco use is number one, causing more preventable deaths and diseases, and a tremendous healthcare cost burden as well. It's the single most preventable, modifiable cause of poor pregnancy outcomes, so quitting can produce significant improvements in health. We've seen a decrease in smoking, but vaping has increased. Alcohol use and misuse is another risky behavior, most common in young adults. When we talk about the health benefits of alcohol, there's really a lot of skepticism about this. We may have been misled by the industry. So if anything, perhaps modest benefits when taken in moderation for cardiovascular disease, but even in moderation increases the risk for cancer. Huge cost again, and the access varies by neighborhood. You'll see targeting of lower income neighborhoods in terms of both advertising and retail in both cigarettes and alcohol. Physical activity and sedentary lifestyle has a huge impact on chronic diseases. We know that physical activity benefits physical health, mental health, social health. 60 minutes a day of activity is recommended. And if that were the case, we would save lots of money with better health. Both adults and children are not getting the physical activity needed to lower the risk of illness. Diet and nutrition, certainly my domain, has become a tremendous problem in this country, contributing to overweight, obesity, and being linked to 4 out of 10 leading causes of death. The recommendations are not only to reduce caloric intake, but to shift toward a plant-based diet with more fruits, vegetables, whole grains, and plant sources of protein. Along with that, obesity rates are soaring as well, with global expenditures at $2 trillion. Even a modest to moderate weight loss can improve metabolic indices, decrease the risk of chronic disease. So, how do we impact health behaviors? How do we make a change in the behaviors of not only individuals but the population at large? Your textbook takes a look at the history of behavior change interventions, starting with the health belief model. The health belief model basically said if they know, they'll change. There was only a modest impact of campaigns like This Is Your Brain on drugs. This is your lung after you smoke. So we moved on from there to the social learning theory, which included cognitive behavioral change, included a tool chest enabling the individual to make changes in the things that triggered poor behavior. So you'll see lifestyle change interventions, nudge principles, multi-component treatments, and lower cost formats here. We embrace the stages of change model. If you work in any field where you are working to change behaviors, it's important to recognize what stage the individual is on this continuum. So, are they just kind of thinking about it, not really thinking about it, ready to take action? Because the particular stage will dictate then what is the appropriate intervention. And social marketing strategies uses marketing principles to encourage population-based change for the most part. We now use social networks and social media extensively in behavior change interventions as well. Your textbook also looks at the role and impact of primary care interventions. So, are primary care providers effective in encouraging permanent behavior change, or at least long term behavior change? And the answer is yes. A little bit of time, minimal contact, can make a big difference. We have learned that simply asking or addressing the 5 A's with a patient, which only takes a few minutes, can make a difference in their chance of behavior change. Patients and clients respect their doctors and take their advice. Unfortunately, your textbook also looks at the amount of time the average physician spends on behavior change, and it's not a lot. So, the multi-level model for population-based health behavior change addresses behavior change by saying we need to do more than one thing. We need to have interventions at different levels. You will actually use this in your homework assignment. Multiple approaches are important. Applying a long view involving different sectors of society. And there are examples from tobacco control, obesity control as well. And you can see here the CDC around tobacco control recommends a number of things, not just one. So, smoking bans, but also price increases through taxes, also mass media campaigns, also having a quit line available. So, a number of different interventions is used. We can categorize these as downstream, midstream, and upstream, and that is something that you'll look at in your homework as well. So, downstream is at the individual level, midstream more at the community or organizational level, and upstream at the policy level. Certainly, provider behavior needs to change. Read about that in your textbook. And the entire system, the healthcare system, needs to be re engineered so that it addresses proactive, preventive, and behavioral care. You can see here a comprehensive approach to changing provider practice, so read through this for sure. And the chronic care model is a system that does just that, that not only looks at the traditional healthcare system, but also how it is structured so as to allow decision support tools, to allow connection with community resources and policies, to allow patients and clients self-management support. Great chapter. Enjoy reading it.